This is Valerie VanBooven with the Senior Care Industry Podcast, where leaders with 3 or more years in the senior care industry share their advice. It's 6 questions in 9 minutes, so let's get to it. All right, in a few sentences, tell us who you are and what you do.
All right, I'm Neil Tantingco. I am an owner of 2 businesses. I own an assisted living community in Central California called Evergreen Residence. But what I'm going to talk about more is I am the owner and founder of a company called Connected Home Living. We're a telehealth provider.
Nice. And we need all of the virtual and telehealth stuff we can get right now. So
that's right.
I'm so glad about that. All right. So tell me, what's the best thing about serving aging adults?
All right. Well, depending which business hat I'm wearing, if I'm when I'm at my community, it's the best line of work because I get 50 hugs and kisses, right? But from a virtual perspective, every time we contact our patients through their personal device or tablet, they love it when we come up on their screen and they had a chance to talk to somebody else other than their loved ones or beyond the walls that they live in.
I imagine so, yeah. We talked to, my dad is in a nursing home and he doesn't have the screen, but he does have an Alexa device. If I say that too loud, she'll talk to us. And he will call me on that and we'll chat, and he loves that. And it's perfect for him. It's not complicated. He wouldn't know how to do it cell phone. So but he knows how to say, call Val.
There you go. That could be dangerous, right?
Yeah, so he'll call and say, I need some more peanut butter, because he loves peanut butter. So I auto ship him.
Nice, smart.
Yeah,
okay.
Well, we can't visit in person right now, so
that's right.
That's how.
That's why we're busy. Yeah, because a lot of people sheltered in place. The virtual visits are powerful.
Yeah, and when we get close to the end here, I'm going to ask you to tell us a little bit more about that, because that's going to be interesting to everybody.
Right.
All right. So we talked about the best thing about serving aging adults. Okay, let's talk about online marketing a little bit. I hear from other senior service providers, online marketing can be challenging, a little confusing. It's ever changing. What is your experience and what are your thoughts?
Yeah, I view that same thought if you're close-minded and you're comfortable with business as usual. But unfortunately, with today's consumers, people that you're targeting, you have no choice but to leverage online marketing, right?
Yeah. I absolutely believe that. I think it's more important than ever. And I can tell because our business has been getting, we're overwhelmed with the amount of calls we're getting, because that's what we do. Right. So yeah, absolutely. So I know there's probably mentors in your life, other successful leaders like you that you might want to acknowledge. We just like to hear from other people who has been important to them in their business and professional life, or even personal life, and has kind of brought you to where, or helped you become who you are today?
Boy, that's a good question. Yeah. So, the question you posed is a little bit different, but the people
you know.
yeah. Well, believe it or not, we've been in business now with the tele business for the past 5 years. We've been confiding a lot with physicians, assisted living, home health owners, and because of their feedback, they've been allowing us to modify and make these changes necessary to improve the outcomes that we deliver. Right now, I want to say the physicians at this particular hospital has added so much credibility to our offering and producing these fantastic results. So I do want to shout out to a doctor named Dr. Pisani. This has been fantastic.
Great. Awesome. Yeah, there's always usually somebody in our lives in some realm or other that we'd love to give a shout out to. So, okay, what piece of advice would you give to other senior care providers? Anything at all?
Boy, that's again an open-ended question. So maybe perhaps technology. A lot of the business owners that I come across, a lot of them are again traditional. Maybe they're comfortable with the way things have always been. For me, that's dangerous, right? You have to have an open-minded, you have to embrace technology, and don't assume seniors are going to be reticent about technology. And I think that's why we're so successful here, is that we take a blended approach, right? Some people are going to be liking technology versus others. So you can't have a peanut butter spread approach. You have to approach each individual individually and figure out what the best technology would be suitable for them.
Awesome. All right, one more question, and then we're going to talk a little bit about connected home living.
Mm.
When you have a win in life, whether it's personal or business, how do you celebrate?
Well, first and foremost, I got to thank the big guy upstairs, the big fella upstairs, give him praise and thanks. But then, yeah, second piece, like I celebrate with my family. You know, we hang out at the beach, get even darker than we are today, and just
Yeah,
soak up the sun. Yeah,
it
nothing
always,
best than hanging out at the beach.
yeah, a good day full of sun and fresh air is always great.
That's
All
right.
right, tell us a little bit about connected home living because this is, I don't usually ask a seventh question, but I'm
Yeah,
going to because this is so important right now. So tell us
right.
about it.
Yeah, so connected home living, all we do is prevent unnecessary trips to the hospital, and we do that by both blending technology or telehealth and around the clock remote care coordination. Right. And what we've done on top of that is that we built programs on top of our telehealth solution. So if you have concerns about COVID, if you have a hospital to home program, or if you have clients who want to stay at home longer, but maybe not quite ready yet for a full time private duty provider, we provide all those services. And
You know
today
what?
we're, yeah. And today
That's
we're in 9 states today and we're growing.
awesome. And you know what? I just was talking to somebody the other day. I said, if somebody's not ready for home care, having a telehealth beyond a personal emergency response system,
Right.
having something in the house that gets you in the door so that you
Mm-hmm.
can still be their go-to until the day comes when that's just not quite enough. That's the best in. I mean, so these people, home care and assisted living, as you know, those to close somebody on that could take 6 months.
That's right.
Um,
You hit it right in the head,
yeah,
because a lot of times when they inquire for our services, yeah, they're just feeling the waters, trying to see what's out there. But at the end, they're not quite ready yet. So, and then sometimes they're not quite ready for a full time or even a part time private duty provider. So we lead exactly with that. We lead with a virtual caregiving, where again we use either their phone or an equipment that we supply, but more importantly, we accompany that technology with a live 24/7 team. So if there's any signs of trouble, within seconds, somebody pops up on the screen to be able to help out that patient immediately.
awesome.
Yeah.
All right. So what we'll do is I'm going to put your contact information with all of this and your website. So if people have more questions, they can go directly to you and talk to you about it.
That's fantastic.
Awesome. All right. Thank you so much, Neil. I appreciate it. This was fast and furious, but everybody's busy these days, so that's how we like to keep it. So
All
thank you for
right.
being on the show.
Well, thanks for having me.
Thanks. Bye bye.
Bye bye. much.